So, first joke of the day. A Mexican magician says he will disappear on the count of 3.
Oh no.
He says, 1, 2, poof. He disappeared without a tres. I thought it was so funny.
Yeah.
Some people didn't get it.
He tried.
He disappeared without a trace.
But what does trace mean?
So one of those is 1, 2, 3.
I'm just asking for my classes.
Alright, next. What do you call a fake noodle? If you know it, keep it to yourself.
Yeah.
No?
A
Idea?
Maruchan.
A Maruchan? No.
A poodle?
No. Any guesses?
Did you say foodle?
Poodle? An impasta. Get it?
Who watched that? I forgot his name.
Stanley, wasn't it?
Stanley!
Yes.
Big old don't get paid for this.
Who's the one that dropped the chili? I forget his name.
Oh, I forgot his name too, but I
And Dwight, the big guy.
Yeah. It wasn't Dwight. It wasn't
It
Dwight.
Dwight.
Start with
Nothing
Nothing kicks over.
Like,
the-
And last one. Why did the skeleton want to go out to the nightclub? Any guesses?
Is it supposed to be there still?
Aw, man.
You heard it.
Oh, man.
I feel like this one should be on the board. All right. Thank you for laughing at my corny joke.
You said you wanted it on the board?
Yes, it should.
Okay.
Yes. They haven't gotten my corny jokes yet.
I'm back.
All right. So CPR. We're gonna go over 3 different techniques. We have our 1-person rescue, 2-person rescue, and our infant rescue. So with the 1-person rescue, the first thing you have to do is obviously establish unresponsiveness. And how do we do that?
Are
Gently
you
shake
okay?
them and ask, are you okay? Are you okay? Like we learn in the CPR classes. If the patient does not respond, you obviously call for help and start CPR immediately. And why do you think we need to position them on a hard surface?
So that you can give the
So they can do compressions, right? Compressions won't be adequate if they're not on a hard surface. So to perform chest compressions, you have to place yourself on the side of the patient, not at their head or their foot. And your hands, where are your hands for CPR chest compressions?
on the chest.
Yeah, they're not wrong.
On the
The
chest, but more
sternum.
specifically, distal sternum, correct?
Exactly.
So you place the heel of your hand on the distal sternum, the other hand on top, your fingers interlaced, and your fingers should be extended, not bent. And for adequate chest compressions, your elbows should be locked in place, not bent, correct? And your CPR starts from your shoulders, just straight down from your shoulders. And if you're giving correct chest compressions, your sternum should be depressed 2 inches, should go down about 2 inches. And what's the rate?
30 compressions for 2 breaths.
2 breaths. So
What
that
is
is
30
your,
compressions for 2 breaths?
yes, that is your 1-person rescue when you're by yourself.
Ma'am, what do you mean by 2 breaths?
2 breaths
2 breaths.
after 30 compressions. All right, and how do we give the 2 breaths? We have to maintain an open airway, and how do we do that? You tilt your head up, or your head back and your chin up. And this, the picture is on page 248 in case you're wondering what it looks like. Place your palm on their forehead and apply firm pressure backwards, and then the fingers of your other hand beneath the bony part of their chin, in this motion, which lifts their chin up. Okay? And what does that do? It prevents the tongue from falling back and obstructing our airway, correct? So the whole point of maintaining an open airway is for air to flow freely. So this prevents the tongue from falling back, yes.
Is this when we search for the obstruction if there is one? Just like quick glance?
Yes, you can. And if you see anything in the throat, what do?
We're not supposed to finger sweep, I thought.
Finger sweep, that's for a patient that's having seizure.
Oh, okay.
And how do you listen for breath sounds? You watch for the rise and fall in their chest, or you feel for air coming under their nostrils, or you can listen. If there's no breath, you would do your rescue breathing. What's the rate again?
30 to 2.
30 to 2.
Rescue breathing, how is it done? You place your palm on their forehead, use the thumb and the fingers to pinch their nostrils. Make sure you take a look at that page, 248. You would place the face mask, if you have one, over their nose and mouth. Take a deep breath in, and then blow 2 deep breaths. Each of those breaths should last about a second. And how do we know if we gave proper breaths? You watch for the rise and fall in their chest. Just like we practice CPR with the dummies. After that, you would check their carotid artery, which is where? By the neck, for about 5 to 10 seconds. If you don't feel a pulse, you would continue CPR. Okay? You should always reassess the patient after completing 5 cycles of CPR. So compressions, breaths, compressions, breaths. After 5 cycles, you reassess for their pulse. And do not take more than 7 seconds to evaluate your patient. Everyone good? Okay. So now we have our 2-person rescue, where one person does the chest compressions and the second person is doing what? The breathing. So the first person's at the side of the patient doing the compressions, second person is at the head of the patient, maintaining your open airway and providing the breaths after your 30 compressions. Compression rate, 30 to 2, should be at a rate of 100 compressions per minute. And of course, you can switch positions if the person giving compressions get tired.
You must, right?
And finally, we have our infant rescue, slightly different than our adult CPR. We would use your 2 fingers, not your whole hand, because they're very tiny. Use 2 fingers at the middle of the chest, intersection of the nipple line. For infants, instead of 2 inches, it should be a 1/2 inch to 1 inch. Same rate, 100 compressions per minute. And it's still 30 compressions to 2 breaths for infants and children below 8.
I thought one of them was 15.
It used to be, I think they changed it. And for children that are 8 and above, the hand placement would be the same as an adult. So anything below 8 would be 2 fingers at the middle of the chest.
You still press 2 inches for a kid above 8?
8 and above, yes. If they're treated as an adult. So, if patients come down to your department, sometimes the nurse will call and give you handoff, and they might say, patient is DNR. Do you know what that means?
Do not
Do
resuscitate.
not resuscitate. So if the patient goes into cardiac arrest, would you do CPR?
No.
No.
Let them go.
But if a patient comes down and if they say it's full code, you would follow the proper procedure for CPR. And then the general rule is once you start CPR, you do not stop until the patient resumes their breathing or the pulse has returned. Or if you're in a trauma situation and the patient has come in on an ambulance, is usually the CPR doctor that says, you know, enough CPR, we're gonna call it.
Call it meaning they check time
Yes.
and do the, okay.
Patient is
Got it.
What are some complications of CPR? Rib fractures, sternum fractures, pneumothorax, lacerated liver and spleen, and fat emboli.
Ambular meaning, ma'am?
Clots.
Clots that are, I forgot to look up what exactly it means. I will let you know. And then this one, just know it for test purposes. CPR skills are recommended for all healthcare professionals by the American Medical Association.
I have a question.
Yes.
Why would why are the DNR patients? Because with rib fractures and all.
Now, if the family or the patient, if they pass away, they just want to be left alone and they don't want CPR, they will be called DNR patients.
Oh, it's when fat is distributed to the bone supply, or the vessels. The fat in the bone. What does that have to do with CPR?
Not exactly sure how CPR causes that.
Maybe if they ate something, and they like forced aspiration. Is that what they mean by pneumothorax? They're like forcing that person to aspirate? Like if they accidentally spit or whatever?
So what does pneumothorax mean?
Or air in the, oh, I'm tripping, I'm sorry.
So if somehow we create a fracture or a rupture of something and the air gets in the thoracic cavity,
Mhm.
they can have pneumothorax.
I was told that if you don't fracture anything, you're probably not doing it right.
But yes, that's a common thing. Not necessarily true, but yes, it's very common for people to get rib fractures during CPR. That was it for chapter 20. Don't worry about it.
That was really
Who was laughing?
Reagan.
That was
Oh.
Reagan, yeah.
So Monday we have chapter 20 and 21, ma'am.
No, just 21.
For the exam.
Cheating, how many compressions?
30.
How many breaths?
Okay, if you guys could get into teams of, or 4 different teams, please.
Can you pick our
We're
teams?
playing a little quizzes. We're teaching.
Can you pick our teams?
Sure, why not?